Hello, this is Dr. B. Grunberg with B's Buzz, and today I'd like to talk to you about the brain, cognitive decline, and Alzheimer's disease. Sounds scary, right? But it doesn't have to be, and that's why I'm addressing this issue today. At the very earliest hint of any kind of cognitive decline, that's the time to seek help, because early enough in the disease, there are some key modifiable lifestyle factors that can really alter the course of the disease. Until now, medications like Aricept, a cholinesterase inhibitor, have proven to be rather underwhelming in their effectiveness to treat this disease. These meds will increase a person's score on a mini mental status exam by 1.5 points out of a score of a total of 30 points. This benefit occurs early on in the disease and lasts for the first 6 months or so of treatment. In essence, mom stays at home, continues to deteriorate, but postpones her transition into the nursing home. Not very impressive, huh? Contrast that to some lifestyle modifications that are at least as effective. A look at 11 studies on the effect of exercise demonstrated a 30% risk reduction in the development of dementia and a 45% risk in the development of Alzheimer's dementia. Thanks to Dr. Dale Bredesen at the UCLA, who is reversing early Alzheimer's, we now understand that Alzheimer's is a multifactorial condition. In today's world of complex chronic diseases, there is no one monotherapy that will cure this or other diseases. There is no one pill for your ill. Trying to eradicate amyloid plaques, for instance, proved to be ineffective at curing Alzheimer's disease. If dementia has a multitude of factors that contribute to its development, then we need to take a multi-pronged approach to its treatment. What are some important factors that lead to the development of this disease process? The most important one is glucose toxicity. In fact, we've coined a new term called type 3 diabetes, in which the neurons in the brain become resistant to insulin. They cannot respond to insulin. Our bodies just cannot tolerate the massive influx of sugar today with the SAD diet, the standard American diet. So what do we do about this glucose toxicity? We need to optimize fasting insulins to less than 5. We need to train our bodies to be more metabolically flexible so that we can burn fat as a fuel source instead of relying on an insulin-dependent carbohydrate state, which leads to insulin resistance and then inflammation. We institute Bredesen's 12-3 Keto Flex plan, in which we eat only for a 12-hour period of time. We fast for 12 hours overnight, and we do not eat for at least 3 hours prior to bed. The diet is heavily plant-centric, very low in carbohydrates, sugars, and gluten-free. Healthy fats are emphasized, and those can come from nuts, seeds, avocados, avocado oil, olive oil, and the healthy omega-3 fats from wild-caught fish that are low in mercury. The diet does have moderate protein intake, and that can be vegetarian-based or meat-based. However, if meat-based, it should be grass-fed and pastured. The diet allows us to be, again, metabolically flexible, and we burn fat as a fuel source rather than relying on insulin-dependent carb-storing diet that leads to the inflammation. Like fasting, exercise creates something known as brain-derived neurotrophic factor, which helps the body achieve a mild state of ketosis, which is what we're seeking with this type of diet. We should also be familiar with our ApoE status. This is the gene that is most correlated with the development of Alzheimer's disease as we age. We get one gene from our dad and one from our mom. We can inherit a 2, 3, or 4 in any combination. ApoE3 is the most common, and ApoE3 individuals have a 9% lifetime risk of developing Alzheimer's dementia. If you carry one ApoE4, your risk is up to 30%. And if you carry two ApoE4 alleles, that risk is greater than 50%. So why know your ApoE status? Why bother? We used to think that genes were our destiny. In fact, insurance companies oftentimes don't even cover our ApoE gene. But now we know that we can epigenetically alter the gene. ApoE4 individuals benefit even more from fasting, even more for increasing insulin sensitivity, even more from moderate intensity exercise and lowering saturated fats. These ApoE4 individuals may have to be more cautious, though, in taking in the MCT oil or coconut oil that is common to these ketotic diets. What else can we do besides decreasing our sugar and knowing our ApoE status and eating to benefit our ApoE status? What else contributes to the risk of developing dementias? We know that there are trophic factors that when we are deficient in these trophic factors, it may lead to a atrophic form of dementia. Therefore, we need to optimize our vitamin D status, vitamin B status, thyroid, and sex hormones. We need to follow biomarkers like the cardiac CRP, which is a sign of inflammation in the body, and our homocysteine, which is a sign of methylation and B status in the body. We must also evaluate our toxic load in the evaluation of brain health. Today's environment is a toxic soup. Heavy metals like inorganic mercury from dental amalgams and also organic mercury from fish contribute to toxicity in the brain. Aluminum is another common toxicity. We must not forget about mycotoxins from mold in water-damaged buildings. It is very common to live in a moldy environment and to be completely unaware of this. There are other biotoxins like Lyme Borrelia that affect our executive function in the brain. If the only treatment that a doctor has to offer is prescribing medicines like Aricept, then they're not looking for some of these hidden causes. A doctor needs to be the detective and ask the patient the right questions. If toxicity is involved in the development of the dementia, then sauna and detox strategies and decreasing the toxic load can be very effective. A very important toxin is lipopolysaccharide, which is an endotoxin created by gram-negative bacteria in our gut. Metabolic endotoxemia causes chronic low-grade inflammation. Lipopolysaccharide can be an indicator of gut permeability and a very unhealthy gut microbiome. In order to have a healthy brain, you need to have a healthy gut and a healthy gut microbiome. Any brain health routine will be focused on mindfulness to decrease cortisol and the stress response, and we emphasize good quality sleep. Sometimes patients have undiagnosed obstructive sleep apnea, which interferes with the quality of their sleep. It would be very important to identify this. We now know that we have a lymphatic system that literally takes the trash out when we are sleeping and rids our body of potentially neurotoxic substances like this beta amyloid. So we need to have good quality sleep. A supplement program might include vitamin D, curcumin, and omega-3 fish oils. I wish indeed that there existed one cure-all for cognitive decline. Indeed, we must intervene in multiple aspects, including lowering glucose toxicity, ridding toxins, decreasing inflammation, decreasing endotoxemia, while optimizing sleep and trophic factors. Here then, the power lies in the hands of the patient, and it is the job and the art of the physician to give back the power to the patient. And I'd like to help you, assist you on that journey. Thank you. Hope you've enjoyed Bees Buzz.